You've probably heard about laser therapy for pain relief. Maybe you've seen the ads or a friend mentioned that it worked wonders for their back or their feet or their neck, but you're skeptical. And honestly, that's smart. With all the wellness trends and miracle cures out there, it's hard to know what's legitimate. So let's cut through the noise and talk about what laser therapy actually is and whether it works and what you can expect if you try it at Oneonta Spine and Laser. Spoiler alert here. We're talking about real science, not say so or not science fiction. So, what is a class 4 robotic laser and what is that therapy anyway? Well, let's start with the basics. When we say laser therapy, we are specifically talking about a class 4 MLS M6 robotic laser therapy. You can actually Google that and look at what people other than me or my patients have to say about it. I encourage more research is better. So it's not the kind of laser that cuts or burns tissue. This is a high-powered, non-invasive treatment that uses specific wavelengths of light to penetrate deep into the body's tissue. Think about it like this. Your cells have tiny power plants inside them called mitochondria. When these power plants are sluggish, thanks to injury, inflammation, or chronic pain, your body struggles to heal itself. Laser therapy essentially jump-starts those power plants back into action. The MLS M6 robotic laser is particularly advanced because it combines two therapeutic wavelengths simultaneously and delivers them through a robotic arm that ensures precise, consistent treatment. It's like having a really high-tech assistant that never gets tired or makes mistakes. But you may be thinking, well, does it actually work? And here's where the rubber meets the road. You want proof, not promise. That's fair enough. The research on laser therapy is actually pretty compelling. Studies show that about 94% of high quality research demonstrated positive effects on pain reduction. And that's not a small number. In controlled studies comparing real laser therapy to fake CAM devices, 72.4% of people treated with real low level laser experienced significant pain reduction compared to only 27.6 in the sham group. So, in other words, they were both receiving what they thought was laser treatment. One of them was the real laser, the other was not a real laser, although it may have appeared so. Now, when it comes to knee arthritis specifically, patients saw meaningful pain reduction after just 7 days of treatment, with effects lasting up to 3 months. Now, here's what matters most. Patients often experience clinical improvement after each individual treatment session. So we're not talking about waiting months to see if it works. Many people notice a difference right away. Now, is it magic? No, it's not magic. Does it work for 100% of the people 100% of the time? No, nothing does. And if someone tells you it does, you should run. But the evidence shows that for most people dealing with musculoskeletal pain, chronic conditions, and inflammation, laser therapy delivers real, measurable results. So you don't need a biology degree to understand this. But here's what's happening inside your body during laser therapy: cellular repair, reduced inflammation, collagen production, endorphin release, and improved circulation. All of this happens without needles, without medication, and without you having to do anything except relax on the treatment table. Here's what a typical session looks like. It takes roughly 20 minutes. Seriously, we're not talking about hour-long appointments here. Sensation, you'll feel a gentle warmth on your skin. Some people feel nothing. It's not painful. Most people actually find it relaxing. Some describe it as a warm massage sensation. When we talk about preparation, you'll wear protective eyewear, safety first, but you stay fully clothed, no changing into a gown for most people. This robotic arm moves precisely over your treatment area, delivering controlled doses of therapeutic light. You just lie there and let the technology do its thing. Afterward, there is no downtime, no recovery period. You can literally get treated during lunch and go right back to work. Most treatment plans involve 7 to 10 sessions over several weeks, with benefits building cumulatively. But remember, many patients notice improvement after the very first session. So let's talk about what conditions laser therapy can treat. Now, of course, we specialize in a few different areas, but peripheral neuropathy, chronic back pain, sciatica, which is the pain running down your hip and your leg, neck pain, knee pain, and osteoarthritis, sports injuries, plantar fasciitis, shoulder pain, and carpal tunnel syndrome are just a few. So, if you're dealing with chronic pain, inflammation, or nerve related issues, there's a good chance the laser therapy can help. Sure, reducing pain is the main goal, but patients at Oneonta Chiropractic and Laser consistently report benefits that go way beyond just hurting less, like better mobility, improved sleep, less reliance on medication, faster recovery, and increased energy. So you may be ready to see if the laser works for you. And for you, I'd like to offer an introductory special. So you can come in, we'll evaluate you, we will do some neurological testing, we will even do a full-blown laser treatment for only $97. I get it. You're probably tired of other treatments that didn't deliver on their promises. Maybe you're tired of temporary fixes that don't address the root cause, or maybe you're just tired of being in pain. The good news is you don't have to take our word for it. The research speaks for itself, and more importantly, so do our patients. If you're dealing with chronic pain, nerve issues, inflammation, or any of the conditions we mentioned, why not give it a shot? With sessions under 20 minutes and no downtime, you've got nothing to lose except maybe the nagging pain that's been holding you back. So if you're ready to start, feel free to give us a call at 205 625 3488 and schedule your consultation. Let's talk about whether laser therapy is right for you and your specific situation.
Well, I had no feeling in my feet at all.
Mm.
And, I got to the point where sometimes when I'm driving, I couldn't feel the gas pedal or the brake pedal and things like that. And my wife, got worried about if I should even drive anymore.
So if someone else was suffering with neuropathy, like the burning, the numbness, the tingling, that kind of thing, would you recommend the laser to them?
Absolutely.
So would you recommend for someone with neuropathy that they try the laser?
Oh, every day of their life.
I had lost hope with debilitating neuropathy, the stinging of the feet, the total numbness. I didn't even know if I had socks and shoes on. I couldn't feel my feet at all.
So how's the laser working for you?
The laser has given me hope
So you're already seeing changes?
already, yes.
Okay.
I saw changes from the very first treatment.
Wow. So if someone had neuropathy and was looking for a real solution, would you recommend the laser?
I have told a lot of people about it, and yet
What was the problem?
Numbness in my toes and foot.
Okay. And so you came in, you tried the laser. How is it affecting you?
There is no tingling, there's no numbness, and very little bad sensation since we have done the treatments.
Okay. So if someone else was struggling with neuropathy, would you recommend they try it?
Absolutely.
I'm 20 years a diabetic and probably 7 years with neuropathy in my feet.
So it was neuropathy that brought you in?
Neuropathy that brought me in. Yes.
Okay. And you're using the laser,
Yes.
and you've had how many treatments?
This is my fifth on my right. The pain has come way down just in 4 treatments.
Okay. So if someone else was suffering with neuropathy, would you recommend the laser treatment?
Absolutely.
Were you told you had neuropathy?
Yes.
You were telling me a little bit ago, that you were how much better, roughly?
I'd say between 45 and 50.
Okay.
And I hadn't been coming that terribly long.
Right. We still got a long way to go.
Yeah.
Yeah.
Uh-huh.
Well, if someone else was struggling with neuropathy, would you recommend they try this laser treatment?
I sure would, highly.
Just a shade under 50%.
Wow. So basically 4 treatments and you're about 50% better.
Correct.
All right, that's a big deal.
Yep.
So if someone else was suffering with neuropathy, would this be a treatment, the class 4 laser, that you would recommend?
Oh, definitely, yes.
You were diagnosed with peripheral neuropathy, right?
Yes.
So you were having burning, tingling, numbness, that kind of thing?
Well, I was in
You were saying that the right leg is how much better?
90%.
90% better.
Yes.
So are you sleeping at night?
Yes, I am now.
So if someone was struggling from peripheral neuropathy, the numbness, the tingling, the burning, a lot of people have balance disorders too. Would you recommend that they do or try the laser?
Sure. I think to me, it's the only way to do it. I had severe neuropathy, particularly in my left foot and milder in my right foot. And I had pain about 5 nights out of every week where I couldn't sleep. And after this treatment, the pain is just about gone from my left foot.
You came in with what, numbness, tingling, burning in the feet?
Numbness in the ankle, and then the toes and sole of my feet, or that foot particularly, was burning, and it was like a pulsing burn shock sensation.
And how long was that going on?
I've had this condition, it's steadily intensified for about 12 years.
So if someone else was suffering with neuropathy and they've tried everything, would you recommend that they try the laser?
I certainly would. I think that this is a good alternative to a lot more medication